Today, we will find out what is asthma and learn about the 4 common symptoms of an asthma attack. What does an asthma attack look like? Let's have a look. We now know what an asthma attack looks like. What you just saw was a child getting an asthma attack. Do you know what asthma is? Well, let's find out. Asthma is a very common condition that affects the air passages in the lungs, and it causes breathing problems. A child with asthma may wheeze, cough, have shortness of breath, or experience tightness in their chests. Our lungs are made up of many tubes or airways to carry air in and out of the lungs. In patients with asthma, the airways are inflamed. When the airways are exposed to a trigger factor, they react by releasing chemicals that cause the muscles around the airways to tighten. The lining of the airways then swells up and produce excessive mucus. These result in the airways becoming narrow, making it difficult for the child to breathe. One of the most common symptoms of asthma is wheezing. Wheezing is a high-pitched whistling sound that occurs when a child breathes out. Wheezing is the most important symptom of asthma, but it does not happen in every child. Coughing is also a symptom of asthma. For some asthmatic children, coughing may be their only complaint. Coughing may be worse at night or early in the morning. Another symptom of asthma is shortness of breath. Shortness of breath is the feeling of not getting enough air going in and out of the lungs. This can be severe enough that it interrupts the child's normal activity, sleep, or exercise. Some children may experience chest tightness. Chest tightness may feel like the chest is being pressured or squeezed. This happens more often in older children, especially after vigorous exercise. Symptoms of asthma differ from person to person. Some children may experience all the symptoms, while some might only experience a few. Some children might experience the symptoms once every few months, while some might have them almost every day. Asthma is a long-term disease that has no cure, but it can be controlled. It is necessary for the child and his caregivers to be aware of how his asthma is triggered. We hope you have a better idea of the symptoms of asthma now. Do check with your doctors and nurses if you want more information. We would like to thank the following for their contributions.